First of all, that the healthcare system of the future will be organized around the individual health and care. So I will start with health. So there will be a lot of importance of well-being before people getting sick. So there will be a lot of effort in prevention. There will be a lot of effort in individual incentives toward well-being. And then care will be organized around the patient with a lot of specialization of the providers and individualized healthcare pathways. There will be a second point, a strong focus on defining, measuring, and delivering value. So there is a common knowledge in any management wise person. Whatever you cannot measure, you cannot manage or control. So everybody, and we among them, believe that measuring not only costs, but also measuring outcomes will be fundamental and will be important to crack the equation of what is really value, which is, as a broad definition, outcome over cost. This equation will need to be cracked somehow and will be constantly measured and will be the key driver of healthcare choices. Third thing, there will be a significant change in the mix of roles and responsibilities of the stakeholders. So countries differ about the role that the state will have, but everybody says the patient will be more involved, the employers will be more involved because they have an interest in healthier employees. There will be a stronger management skill set in healthcare with more independent management, less linked to politics. And this will completely change the picture of the stakeholders. Plus, there will be several non-healthcare stakeholders, like food and beverage industry, will start playing a role in healthcare. Urban developers will start playing a role in healthcare because the way a city is developed, the urbanistic of a city is developed influences the healthcare status of the population. So a change in stakeholders. Then, of course, the countries differ. If you compare China with the Netherlands, of course, you have a few differences. So, for example, some say there will be a strong social equity, and some say there will be a strongly market-driven dynamic. Some say that there will be that actually healthcare will still be a cost to be managed. Some say that healthcare will be a growth driver. So it's actually good that 20% of healthcare of the GDP goes to healthcare. Finally, they differ about the role of the government. Some say that the government will be, the ruler of the system. Some will say that the government will just be an arbiter, maybe a multinational arbiter, not even a country arbiter. So these very different visions, but with very similar for some terms and very different from some others. Interesting also the common themes emerging in terms of strategy. Now, some of these topics will be further developed in following interventions, so I will not go in detail through them. But I would like to tell you that I would say two key messages. First of all, there is not one silver bullet. Several things need to happen in the healthcare system. So things that start from measuring value and investing in greatest return, which means understanding where the value is and making choices in terms of technology, in terms of treatment, in a trade-off mindset between cost and outcome. Foster skill and will to create value-conscious customer. This means giving the customers, the patients, the ability to understand the consequences of their behaviors. So it is actually very important that everybody is aware of the cost, the social cost of their behaviors, and about the cost of their treatment, and why certain choices are made, etc., etc. And there are already examples in the world. For example, there's a Vitality Health in South Africa, which you would not say it's the most advanced country in terms of payers, but indeed there's a very interesting example of a mile program based on your lifestyle. So you actually gain points. Vitality is a payer, so you gain points with this payer if you behave in a healthy way. So if you go to the gym, if you buy healthy food, etc., and you gain miles, which you can use in hotels, in travels, etc. Interesting example. And following others. So there's a series of levers that need to be played. And yet the second key message is this is not a single stakeholder effort. So this is not something that can stay within the healthcare sector. This needs to involve the healthcare sector, but also the individuals, the education sector. So it needs to involve the education sector, the Ministry of Labor, the Ministry of Urban Development, or whatever it's called in your country. So it needs to involve the food and beverage industry, and so on. So it needs to involve the unusual suspects. These are the two main messages that are coming out, and with this I will close. And I think I just want to encourage stakeholders to really join in this effort to developing a longer-term vision, which is important, is an important target, because we are in front of a multi-year journey that needs the contribution on everybody. Thank you.
I'm Finn Børlum Christensen from Denmark. Denmark is a country in the north, about the same size in terms of population as your country. We have a longer coastline than you have, because we have a lot of islands, as you know. I was very honored to be invited to be here and present in this forum. I think it's a great idea to have such a forum at this time in your country, and I do hope that my contribution can also be helpful for the discussions you have about the future of your healthcare. I worked in health technology assessment for many years. I led the Danish HTA from when the first national institution was established in '97, and currently I'm 100% working for a European process of HTA. So just very briefly to get a common sounding of what HTA is. It's a science-based activity that aims at informing policy. It's not defining policies, but it's informing policies. And it's focused on patients, so it seems, just leaning on what was just presented, that when you have these surveys asking people about how are things going to be in the future in healthcare, indeed issues of the patient are in focus and value is in focus. So HTA is actually trying to bring these things together, and it's firmly rooted in research. So many other things go on in decision making that are not only research, but the role of HTA is to build on the research and feed it into the decision processes. I was actually given a number of questions for this presentation, and so you see here on the screen that there is this statement that has been along until now in this meeting, that the costs and limitations are threatening the sustainability of the system. So the first question was, to what extent can the answers to such questions be sought in the application of HTA processes? And again, to underline that HTA is a tool that brings together the research-based overview on the sort of the prerequisites on applying new knowledge, applying technologies, and also the consequences for the patient and the system of applying those technologies. Technologies can be anything from psychiatric care to surgery to devices and medicines. So HTA is providing a relatively robust and stringent information into the processes, and where it works best is in the systems where it works together with mechanisms of advising and recommending, so that the HTA is sorting out the evidence, maybe doing the health economic analysis, etc. And then there is a mechanism of advising and recommending that take in other things into the final recommendations into policy. It may be that you have done work in an area of rheumatoid arthritis or diabetes, and those who are advising also need to think about that there are also other patients with other chronic diseases that need also to be taken into account. And that's where this process becomes a little more complicated. And as I underlined already, HTA thrives when it works in a system that makes sure that the HTA products can be used into a wider advising and recommending system. So this is another way of describing the interaction or the life together between HTA and policy making and decision making, that ideally HTA should work in a system where it's the policy and decision making that is defining the questions that the HTA should answer. It could be, how could we have a reasonable policy for taking care of type 2 diabetes patients? How should the distribution or work be between the tertiary healthcare, the hospitals, and the primary care? That leads to a number of questions that we call HTA questions. And when you move that way, you move into the HTA paradigm, where you try to do the best you can to apply research methods in getting clarity. Typically, this is including making sure that you have a systematic overview, a systematic oversight of the published literature, but you would typically also bring in demographic and epidemiologic and economic organizational information into such an exercise. And then when you finish, again, you feed your reporting back to the decision processes. So the challenge in this country is also to find out how this could work in a system like your healthcare system. Now, very often HTA is associated with evidence-based medicine and health economics, and that is indeed correct. But it's important also to emphasize that it takes in ethical or social aspects. So aspects about the well-being of the patient group or the patient beyond the immediate clinical outcomes is actually also sometimes very relevant to bring in, and it is within the paradigm of how to do HTA. Much of research is in the clinical field, and less research is currently in the field of perceptions by patients and organizational structures. But that kind of research does exist and can be mobilized into this broad multidisciplinary process. Even in your country, you will have different kind of university departments or other groups that could participate with their knowledge into such a process. I was also asked to what degree has HTA processes been implemented in European countries. And this is an overview of the countries that definitely have designated bodies to provide HTA. The systems that these countries have are quite different. Some are the so-called beverage model. That means that it's mainly tax-based health systems. Others are based more on statutory health insurance. I guess in this country you have a health insurance that is an important factor in relation to decision making. So in this country it's very important to make sure that the statutory health insurance is involved in a process of furthering the use of HTA. Some countries are mainly applying the HTA at the decentral level, at the regional level, simply because they devoluted a lot of their healthcare to the regional level. That is, for example, the case in Spain and to some extent also in Italy. In some countries, like in France and United Kingdom, you'll hear about France tomorrow if you join the round table tomorrow. There are simply built-in mechanisms to ensure that HTA is applied for certain questions. So who should be involved in the processes? I'm not particularly going into which kind of scientific backgrounds people should have, but it's important that those who are providing the healthcare, be it the professions or the institutions, that they are involved. The payers in this country, it would be health insurance that should be involved in the process. Patients should, of course, be involved, but also industry. This is also reflected in how the stakeholder forum in our European network is constituted. It has these four groups.